Living Well During a Pandemic, presented by Michelle Williams, ND, and Independent Living Resources. Disclaimer: all information in this video and the course is for educational information only and does not constitute for medical advice. Anyone seeking medical advice should speak with their medical providers. All recommendations included in this course are basic supportive measures and are not meant to diagnose or treat COVID-19. Please speak with your medical provider prior to initiation of any supplementation or exercise regimen to ensure it is safe for you. Treatments for COVID-19 that are discussed are for information only. Anyone seeking treatment should speak to their medical providers. Living Well During a Pandemic, a 6-week course. Are you confused about the COVID-19 pandemic and all of the information coming at you from different angles? Wondering what precautions you should take seriously and which vaccine is safe and effective for you? Finding it difficult to communicate with others in your life who have a differing opinion on the pandemic and the recommendations? Or looking for ways to help boost your immunity and manage stress? If you answered yes to any of these points, this is a free on-demand course aimed at helping you answer these questions and gain insight and tools for living well during and after the pandemic. Living Well During the Pandemic course design. This course is divided into 6 weekly video segments discussing different aspects of the pandemic, which will be available every Monday on YouTube to view on demand. There will be a Zoom drop-in session for you to ask myself any questions you have based on the content you have viewed. Tuesday, November 29th, 2022 at 2 p.m., Monday, December 12th, 2022 at 11 a.m., and Tuesday, December 20th, 2022 at 2 p.m. Living Well During the Pandemic and weekly course descriptions. Week 1, which we covered last week, is what do we know about SARS-CoV-2 pandemic and how has it changed and affected our lives. Week 2, this video will talk about measures for protecting yourself and others who are at risk for serious COVID infection and other viruses this fall and winter. Long COVID, what is it and how do we live with it? Week 3, vaccinations. What vaccinations are available, who should be vaccinated, and with which one? What are the concerns? Vaccine efficacy. Week 4, how to communicate effectively with individuals who may have differing opinions about the pandemic and protective measures. Week 5, increasing immune function, part 1, nutritional guidance and supplementation. Week 6, increasing immune function, part 2, reducing stress and wrapping up. COVID-19 risk factors. Anyone living and breathing is susceptible to contracting COVID-19. However, there are certain populations that are at a greater risk for serious disease. These include pregnant women, immune-compromised, elderly. These individual populations are at a much greater risk for adverse events and potential hospitalizations. Individuals with chronic health conditions are also at a greater risk. This includes heart disease, diabetes, Parkinson's and Alzheimer's disease, cancer, kidney disease, post-transplant or on immune suppressants, clotting disorders or history of stroke, autoimmune conditions may be worsened or reactivated with COVID infection. Treatment options include: the FDA has approved the following treatment options for active COVID-19. Antivirals. Remdesivir is FDA approved and the only medicine that is approved for use against COVID. Must be started within 7 days of onset of symptoms. Is administered by IV, 3 doses over 3 days, and is appropriate for adults and children. Oral Paxlovid is a 5-day course and must be started within 5 days of the onset of symptoms. Adults and children 12 years and older. IV bebtelovimab, or BEB, is a secondary choice for those who have contraindications to the oral Paxlovid. It must be administered within 7 days of the onset of symptoms and is IV, 1 single dose. It is appropriate for adults and children 12 years and older. Molnupiravir is an oral medication that must be started within 5 days of symptom onset and is recommended in adults only. Evusheld is a monoclonal antibody regimen for moderately to severely immunocompromised individuals or for those who cannot receive the vaccines due to allergies. This is not a treatment for COVID, but a preventative medication and must be repeated every 6 months. Treatments continued, experimental or supportive. None of the treatments on this page are FDA approved for treatment or support of COVID-19. Many providers are trying to help those recovering from COVID or long COVID to return to some sense of normalcy. The treatments listed below are not meant to treat active COVID-19 infection, but may be helpful to improve energy and brain function following a past infection. Vitamin D. It is an important nutrient in human metabolism, improves immune cell function, reduces inflammation, and supports mood. It's often necessary to supplement. However, it is important to check in with your medical provider before starting this supplement because it is possible to get too much and end up with toxicity. Vitamin C. This vitamin helps to stimulate white blood cell activity and reduce oxidative stress on the blood vessels and other tissues. Vitamin C can be dangerous for certain medical conditions such as kidney disease and should not be started without speaking to your medical provider. B vitamins. Various B vitamins are necessary cofactors for neurotransmitter production, nerve tissue integrity, and other metabolic processes. B vitamins are often found in our food, animal products, dark leafy greens, etc. If you think this might be helpful for you, please speak to your doctor about whether this is a safe treatment for you. Ivermectin. There has been a lot of discussion about this treatment as an option for treating active COVID. This medication is not a recommended treatment for COVID-19. There is not enough research to support the use of this medication for COVID-19, and it could be a very dangerous and toxic treatment. There are clinical trials underway currently to assess the effective dose and safety of this medication, but at this time, there is no approved dosing. Long COVID. Synonyms: long haul COVID-19, long COVID, post-acute COVID condition. Long COVID is now protected under Sections 504 and 1557 of the Americans with Disabilities Act. The long COVID condition. According to Health and Human Services, in order to qualify as long COVID, the symptoms must be present for greater than 28 days after the initial COVID-19 infection. Physical and/or mental severity varies and does not have to severely impact an individual's ability to perform activities of daily living, ADLs, in order to qualify for disability. Symptoms often include delayed loss of smell and taste, neurocognitive disruption or delay, brain fog, chest and pulmonary dysfunction, including shortness of breath and chest pain, as well as cardiac arrhythmias, and pericarditis, which is inflammation of the heart. Dizziness, fatigue, muscle weakness, dermatitis or itchy skin, and hive rash development, etc. Adults age 40 to 54, women and individuals with chronic health conditions are at greater risk of developing long COVID symptoms. However, anyone can develop long COVID. COVID clinics in the Portland metro area. OHSU Long COVID-19 Program is a program to serve patients suffering from lingering symptoms from COVID-19 that last greater than 28 days. This program consists of an intake and the team making a plan that will be collaborated with the patient's PCP, your primary care provider, to continue the care plan. In order to contact them and make an appointment, call 503-494-8311. Additionally, physicians can fax patient referrals to 503-346-6854. And for questions for prospective patients, you can call 833-647-8222. The contact physician is Eric Herman. Providence also has a long COVID recovery clinic, which offers a multidisciplinary approach to long COVID symptoms. They offer physical therapy, speech and occupational therapy, behavioral health, medical nutrition, and specialties such as pulmonology, cardiology, neurology, etc. on a need-by-need basis. To make an appointment, call 971-326-8718. Now that we're done, what thoughts do you have? Join us for a Zoom drop-in session to ask questions or talk to others in the community. I will be available to answer questions or guide the discussion. The Zoom meetings for 2022 are Monday, November 14th and December 12th at 10 a.m. and Tuesday, November 29th and December 20th at 2 p.m. All meetings are open to ILR consumers and are a safe space for conversation and questions. Anyone acting aggressively or rude to another attendee will be immediately removed by the administrator of the meeting. References: CDC Coronavirus Disease 2019, COVID-19, Centers for Disease Control and Prevention, 11 Feb 2020, www.cdc.gov/coronavirus/2019-NCOV/your-health/treatments-for-illness.html, accessed 15 November 2022. CDC Healthcare Workers Centers for Disease Control and Prevention, 11 Feb 2020, www.cdc.gov/HCP/clinical-care/outpatient-treatment-overview.html. NIH COVID-19 Treatment Guidelines, ivermectin, National Institutes of Health, 11 Feb 2021, www.covid19treatmentguidelines.nih.gov/therapy/ivermectin/. Office for Civil Rights, OCR, Guidance on Long COVID as a Disability under the ADA Section, hhs.gov, 26 July 2021, www.hhs.gov/civil-rights/for/civil-rights-covid-19/guidance-long-covid-index.html. That concludes week 2. Thanks for joining me this week. Come back next week for week 3 video on Monday, November 28th, and a Zoom drop-in session Tuesday, November 29th, 2022 at 2 p.m. Meeting ID 876-7043-0651.